One thing that really makes me cringe in the clinic is when patients are told by a questionable therapist that their spine is crooked, or worse, when they use the term scoliosis incorrectly. So let's clarify what a crooked spine actually means. We'll discuss the symptoms and treatments for scoliosis, and most importantly, throughout this video, we'll cover the essential things everyone who thinks they have a crooked spine should know. Many people will hear at least once in their life that their spine is crooked. Whether it's the neck with a torticollis, the lower back with a tortipelvis or lumbago, this idea is extremely common. However, it's important to understand that your spine is not crooked. On the outside, it may appear deformed, but internally, it remains completely straight. The problem comes from large muscle groups in the neck and back contracting to protect the painful area, giving the appearance of a crooked spine. But is it possible to have a crooked spine without scoliosis, and could it cause health problems? You need to understand that the spine evolves throughout life, and some people may have different appearances of their spines. For example, some people will develop a buffalo hump at the cervical-thoracic junction, while others will have extremely straight necks, known as military neck. Some may have less pronounced curves in their lower back, while others might have a very pronounced curve, which for some men and women might be perceived more positively because it gives the appearance of a more pronounced backside. It's important to understand that just because your spine looks different doesn't mean you'll have health problems. However, some questionable therapists might use these differences to justify expensive, long-term treatments, knowing it's easier to make money if they create a problem and offer you the solution. But here's the question you should be asking. At what point does a crooked spine become scoliosis? For scoliosis to be confirmed and diagnosed, two criteria must be present. The first is that there must be a lateral curve, typically with an angle measured between 10 and 15 degrees, which is found between the most inclined vertebrae at the top and bottom of the curve. But more importantly, there must be rotation of these same vertebrae, not just an awkward manual measurement by a questionable therapist. Depending on bone maturity, in other words, the patient's age, and the severity of the curve, this will determine whether we take a conservative approach, which is more passive, where the spinal curve is remeasured over the years. This is done in conjunction with conservative treatments to improve mobility and ensure that patients are doing home exercises to strengthen the spine and try to slow the progression. For individuals far from bone maturity with slightly more aggressive scoliosis, a thoracolumbar brace may be recommended, which generally needs to be worn for more than 18 hours a day, not to reduce or correct the appearance of scoliosis, but simply to prevent it from getting worse. In severe scoliosis cases, especially at a young age, surgery may even become necessary. Depending on the degree of scoliosis, this can lead to movement restrictions, discomfort, pain, and breathing difficulties, but it may also cause no symptoms at all. It is crucial to understand that scoliosis should never justify a sedentary lifestyle. As with many health conditions, physical activity and movement will ease discomfort and make chronic pain more manageable. Legendary Jamaican sprinter Usain Bolt, holder of several world records, was diagnosed with mild scoliosis during his youth. Former NFL player Curtis Martin was inducted into the Pro Football Hall of Fame despite having scoliosis throughout his career. Olympic gold medalist and multiple-time world champion skier Lindsey Vonn overcame her scoliosis to become one of the best athletes in her discipline. These athletes demonstrate that determination can overcome any biomechanical anomaly in your body. And more importantly, it shows the importance of subscribing and clicking the little bell to be notified of all my future videos. Share your story, comments, suggestions, or simply ask if you still have any questions. Because an informed person is a person in control of their health.